While pediatricians still use the word colic, we prefer to use the period of purple crying because it lets parents know that this isn't a scary diagnosis, but a developmental stage that has a beginning, a middle, and most importantly, an end. The fussiness many babies experience in the first 3 to 4 months of life is due to a maturing nervous system. It's important to know that not all babies have fussiness during the first few months. Fussiness has a large spectrum. I let parents know that it's certainly common and give them tools for what to do if their baby becomes fussy. Parents need to feel confident that there's not a medical concern with their infant. A baby's cries during the period of purple crying can often sound like they're in pain. If parents are concerned, they should bring the baby to their doctor to have them checked out for other reasons for fussiness. If the evaluation is normal, it's a good time to have a conversation about how to manage fussiness. If your baby gets fussy in the first few months of their life, you should try using the 5 S's to help soothe your baby. The first S is swaddling, so wrap your baby up in a blanket or a sleep sack. The second S is sucking. Babies suck, kind of like baby yoga, so use a pacifier or even your pinky finger to have the baby suck. The third is sideways. Babies who are fussy enjoy lying on their side with their face facing outward. The next one is swinging, so a gentle rhythmic movement back and forth can help your baby feel safe and comforted. And the 5th S is shushing. Shushing has to be loud and continuous, just like the baby's crying. So you might want to try using a tool other than your own voice, something like a bathroom fan or a vacuum cleaner. Even infants appreciate a good bedtime routine. Routines typically happen at the same time every night. A great idea is to include 1 or more books, and maybe even a song, and definitely cuddling. The best idea is to place your infant in their safe sleeping environment like a crib with a firm mattress and no pillows, blankets, or bumper pads. Place her drowsy but still awake. The baby can then learn how to self-soothe and put herself to sleep without needing the parent to be there. Repeat this same routine each night so the baby learns what to expect. Sleep training is very personal and depends on what parents and babies prefer. I tried the cry it out method with my kids and it worked great, but many parents in my practice don't want that at all. It depends on if the infant is sharing a room with older siblings, or if the infant has frequent infections that need a parent's care, or if the child is in foster care. Parents should be aware that bed sharing in the first year of life is dangerous, and that most babies older than 6 months can learn to soothe themselves to sleep if allowed. If parents are nervous, they can talk more with their doctor about this or visit www.healthychildren.org. Parents can help children with separation anxiety by playing games like peekaboo and hide and seek. They can also ask toddlers to bring them books or shoes or toys that are in another room, just for practice. A big challenge for a lot of parents is drop-offs at daycare. Most children just need a warm but brief goodbye with reassurance that the parents will be back in the afternoon to pick them up. Drawing out the goodbye makes the anxiety last longer. Don't try to draw out goodbyes at the drop-off for daycare. Don't abruptly leave the child without a warning. And don't put young infants and toddlers in timeout, as this can make anxiety and behaviors worse. Baby-proofing when infants become mobile is so important for safety. Gating stairs is the most important, in my opinion, to prevent falls. But locking away medications and cleaning supplies is also important. Covering outlets and keeping curtain poles out of reach is also important. And never leave a bag, backpack, or purse in a toddler's reach. Normal exploratory behavior promotes independence, curiosity, and learning. It is an essential part of toddler development. It's important for parents to know that this isn't a bad behavior and how to redirect children when they might be exploring in areas that are unsafe. For example, it may be dangerous to climb up onto a ledge. The climbing behavior isn't bad, so punishment or yelling isn't needed. A redirection is all that you need to keep your child safe. Maybe they can climb onto some pillows. It's so easy for parents to become reactive when their toddler is being stubborn. If parents can maintain their cool and not take it personally, but understand that this is what toddlers do, then their responses can be more positive and productive and can change behavior both in the short term and in the long term. I try not to blow my lid, but adult tantrums do happen. Most young children are not great with abrupt changes in activities. If you have to abruptly stop a fun game or activity, it will almost always lead to tantrums. You can prevent upset times like these by a consistent practice of giving a 3-minute and a 1-minute warning before the activity ends. Children will learn what is expected and will be more likely to make the transition without a fight. Toddlers need to feel like they have independence and autonomy in their day, but sometimes they don't. So during those times, like when it's time to go to preschool, you can give them the choice. Which should we put on first, our shoes or our coat? This allows toddlers to maintain some control. You have to be careful not to give choices like, do you want to put on your shoes? Because that's not really an option. In early infancy, I encourage families to listen to the baby's cues and feed every 2 to 3 hours as their baby requests it. But when infants start solids, parents can begin routines. By 9 months, I encourage families to try to have breakfast, lunch, and dinner with their child as much as possible, to model healthy eating behaviors, and develop routines to encourage healthy eating practices. Picky eating is stressful. It's important that parents understand that good nutrition is learned over time. It's not instant. Nutrition is a marathon, not a sprint. It's the parent's job to present young children healthy meals, and it's the child's job to choose the quantity. Mealtime should be pleasant, and parents should avoid feeding too many snacks to kids who don't eat well at mealtimes. Talk to your doctor if you are concerned that your child is missing some nutrients in their diet, or if they have trouble chewing or swallowing their food, or if you are worried about their growth. I start the potty training conversation at the 2-year visit, but a small percentage of children will start as early as 18 months. Some children might be as old as 3 years or more when they are ready. Children may start to comment on their bowel movements. I pooped, and this is a great chance for parents to discuss where to poop or pee. Parents should openly discuss potty training without shame or embarrassment. The process should always be positive and without punishment for accidents. Rewards like sticker charts help motivate many children. Parents should monitor for constipation and stool-holding behaviors like hiding or leg crossing. If children are hesitant to use the potty, oftentimes I will talk about the poop party. When you flush the toilet and wave goodbye to your poops, you can imagine them going underneath the house into the pipes below the house, where all the poops have a happy poop party. If you're still pooping in your diaper, your poops are sad because they're not getting to the poop party. So you can encourage your child to invite your poops to the poop party